Assalamualaikum and hi. Today, my group and I would like to present about the cardiovascular system. Let's begin our presentation today with the introduction of cardiovascular system. What is cardiovascular system? The cardiovascular system is the circulatory system in our body. The organs that involved in this system are heart, blood, and blood vessels. It is circulated throughout the entire body of a human or other vertebrate. It includes the cardiovascular system or vascular system that consists of the heart and blood vessels.
Alright, I will continue to explain about the structure of anatomy of the cardiovascular system. Cardiovascular system, also known as blood vascular or simply the circulatory system. It consists of the heart, blood vessels, arteries, veins, capillaries, and blood. See, there are diagrams given in this slide. There are two different colors in the diagram, red and blue. Red represent as arterial circulation and blue represent as venous circulation. In the arterial circulation, there are tissue capillaries, arterioles, aorta, artery, and pulmonary vein. Meanwhile, in the venous circulation, there are tissue capillaries, venules, veins, and pulmonary artery.
So I will explain function of cardiovascular system. Cardiovascular system consisting of heart and blood vessels. It is essential for keeping our bodies healthy and functioning properly. The heart acts as a pump, and the blood carries oxygen and nutrients to all our organs and tissues. At the same time, the blood pick up waste products like carbon dioxide and transport them to the lungs and kidneys for removal. Beyond its delivery role, the cardiovascular system also helps regulate body temperature, balance fluid levels, and support the immune system by transporting infection-fighting cells. The conclusion, the cardiovascular system plays a critical role in maintaining our overall health by ensuring everything is delivered where it is needed and waste is efficiently removed.
I will explain to you about the blood flow in cardiovascular system. First of all, oxygen's poor blood from the body enters your heart through two large veins called the superior and inferior vena cava. The blood enters the heart's right atrium and is pumped to your right ventricle, which in turn pumps the blood to your lungs. The pulmonary artery then carries the oxygen poor blood from your heart to the lungs. Your lungs add oxygen to your blood. The oxygen-rich blood returns to your heart through the pulmonary veins. The oxygen-rich blood from the lungs then enters the left atrium and is pumped to the left ventricle. The left ventricle generates the high pressure to pump the blood to your whole body through your blood vessels. When blood leaves the heart to go to the rest of the body, it travels to a large artery called the aorta.
Finally, we would like to explain regarding the abnormal conditions of the human heart. One of the examples is the condition known as arrhythmia. Arrhythmia is a heart rhythm abnormality. Now, this can either be due to the fact that the heart is beating too slowly, which is called a bradycardia, or too quickly, which is called a tachycardia. The most common cause of a bradycardia is intrinsic disease within the conducting tissue of the heart, and this is normally treated with a pacemaker. If your heart beats too quickly, this is called a tachycardia, and the most common reason for a tachycardia is atrial fibrillation. This diagnosis is prevalent in more than 5% of the population above 60 years of age, and the most common risk that predispose patients to atrial fibrillation includes hypertension, diabetes, or a previous history of a heart attack. Next is the congenital heart disease, also known as CHD. Congenital heart disease is a large group of defects in the way the heart develops in the fetus when they are in the mother's womb. One child roughly in 100 is affected by the congenital heart disease at birth. The cause of congenital heart disease can be multiple. In some families, there can be a genetic defect that can cause the abnormal development of the heart. In some other families, there can be diabetes during pregnancy or exposure to drugs or substances during pregnancy. In other families, there are no clear cause for the abnormal development of the heart. Children with congenital heart disease we need to have medication administered to help their heart in the process of healing. In some other children, an intervention is required. This intervention could be either in the form of a keyhole with the use of special techniques where we can, for example, enlarge narrow valves or close holes in the heart. In some other children, unfortunately, especially in smaller children, these keyhole options are not available and the children may require surgery, which could be open heart surgery or non-bypass surgery. It is typically used for newborns and very small children that require their condition to be treated. Most children make a very quick and full recovery and they have an excellent quality of life afterward. The human cardiovascular system is like a highway network inside our bodies. It carries blood, oxygen, and nutrients to all parts like a delivery service. This system is super important because it keeps everything running smoothly, like making sure your body gets what it needs and gets rid of waste. If anything goes wrong, like clogs in the arteries or high blood pressure, it can cause serious problems like heart attacks or strokes. To keep it healthy, you need to eat well, exercise, and avoid things like smoking. Regular checkups with the doctor can also help catch any issue early, so taking care of your heart and blood vessel is key to staying healthy and feeling good. And for that is all we need to know about the cardiovascular system in the human heart. That is our presentation for today. Thank you for watching and have a nice day.